25. Informatics. Current Procedural Terminology, 4th edition, CPT 4. Comprehensive listing of medical terms and codes for the uniform designation of diagnostic and therapeutic procedures, used in the United States for coding for physician reimbursement in hospital outpatient and ambulatory surgical procedures. Electronic Health Record, EHR. A longitudinal electronic record of patient health information generated by one or more encounters in any care delivery setting. Included in this information are patient demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. Health Information Management, HIM. The allied health profession built around the management of the healthcare record in its physical form, as well as the management of data and information within the medical record. Health Informatics. The interdisciplinary field that studies and pursues the effective uses of biomedical data, information, and knowledge for scientific inquiry, problem-solving and decision-making, motivated by efforts to improve human health. Health Insurance Portability and Accountability Act of 1996, HIPAA. Federal legislation passed to improve the efficiency and effectiveness of the healthcare system. Components that affect health information include privacy, security, and the establishment of standards and requirements for the electronic transmission of certain health information. International Classification of Diseases, 10th Revision, Clinical Modification, ICD-10-CM. The classification system that replaced ICD-9-CM, Volumes 1 and 2 on October 1, 2015. This classification system is used for diagnosis coding in all healthcare settings in the United States. Medical necessity. Healthcare services or supplies that are needed to diagnose or treat an illness, injury, condition, disease, or its symptoms. Revenue cycle. The process of patient financial and health information moving into, through, and out of the healthcare organization, culminating with the healthcare organization receiving reimbursement for services provided. As a result of the growth in electronic health record, EHR, systems, health informatics has emerged as an interdisciplinary field. Health informatics is the overarching field that pulls computer and data science, big data, information technologies, health information management and data analytics all into one, focused on improving health and healthcare. Informatics seeks to improve outcomes, lower costs, increase patient safety, and promote high-quality services. Although there are five areas of informatics, clinical informatics is utilized every day by the imaging professional in caring for patients. 1. Translational bioinformatics focuses on the application of informatics principles to understand and manage biomedical data to improve scientific inquiry, problem-solving, and decision-making. 2. Clinical research informatics deals with the use of informatics in managing information and data for clinical trials and research, and uses secondary data to discover new knowledge about health and disease. 3. Clinical informatics involves the application of information science and technology to deliver and improve healthcare services. This is also sometimes referred to as applied or operational informatics. 4. Consumer health informatics centers on patient-focused informatics, health literacy, and consumer education. It includes informatics that empowers consumers to manage their own health through resources like personal health records and internet-based tools. 5. Public health informatics focuses on using informatics to support public health and population-based initiatives. This includes activities related to disease surveillance, health promotion, and managing health information on a community level. The electronic health record, EHR, has significantly altered how health information is managed. The Master Patient Index, or MPI, is an electronic file that identifies all patients who have been admitted or treated at a healthcare organization. 2 levels of data elements should be included in the MPI, 1. Demographic data and 2. Visit-level data. The history and physical provides detailed information of why the patient is being seen for the current episode of care, their medical history, physical examination, a clinician's impression or diagnosis, and a plan of care. Components of the history and physical. Chief complaint, CC. Statements by the patient of signs and symptoms that caused them to seek medical care. History of present illness, HPI. A chronological description of the development of the patient's illness. Review of systems, ROS. A systematic inventory of all body systems, as reported by the patient, that is helpful to the clinician and may identify other symptoms. Past medical history, PMH. Summary of the patient's past illnesses, surgeries, pregnancies, allergies, and current medications. Family history. Illness and diseases among past or current family members that may have an impact on the patient's current health status. Social history. Marital status, education level, occupation, home environment, dietary habits, sleep habits, exercise patterns. Use of alcohol or tobacco and other social determinants of health. Physical examination. Performed and documented by a clinician that may include all body systems or body systems relevant to a clinician's specialty. Impression or diagnosis and treatment plan. A possible list of diagnoses is documented along with a treatment plan. Healthcare organizations have policies in place that state a specific time frame for completion of the history and physical, which is no more than 24 hours after a patient is admitted for inpatient care. In outpatient care settings, completion of this document is done at the time of the encounter. An operative report is a description of the details of a surgical procedure. This report is to be written or dictated by the surgeon immediately following surgery and should be made available in the patient's medical record as soon as possible. Components of the operative report. Surgeons and assistants. Preoperative diagnosis. Postoperative diagnosis. Procedure. Anesthesia. Description of the procedure. The surgeon is responsible for electronically signing and dating the document. A problem list is created and managed in the electronic health record through a combination sources. Problem lists facilitate continuity of patient care by providing a comprehensive and accessible list of patient problems in one place. All treatments and procedures, or medications to be administered to a patient require a physician order for the purpose of diagnosing a patient's illness or symptoms. Orders should include the test to be performed along with a diagnosis or sign or symptom. Physicians may send orders directly to an ancillary department through a computerized physician order entry system or CPOE. CPOE systems are generally integrated with clinical decision support, CDS, systems, which has significantly reduced unnecessary and inappropriate imaging. In January 2020, requirements for an appropriate use criteria, AUC, consultation prior to any advanced diagnostic imaging order was enacted for Medicare patients, and AUC consults must be documented for reimbursement. CDS helps providers engage patients in their care and can also be used to show why an exam may be unnecessary. A patient portal is a secure online website that gives patients convenient 24-hour access to personal health information and medical records, called an electronic health record or EHR, from anywhere with an internet connection. The Health Insurance Portability and Accountability Act of 1996, HIPAA, mandated that patients have a right to access their personal health information. In December 2016, the 21st Century Cures Act, made it mandatory for hospitals and health systems in the United States to provide patients with notes, reports, images, etc. through patient portal applications. The revenue cycle is the process of patient financial and health information moving into, through, and out of the healthcare organization, culminating with the healthcare organization receiving reimbursement for services provided. This process has a beginning, a middle, and an end point that involves several departments, staff, and information technology. Medical necessity is part of the front end of the revenue cycle process. Medical necessity is defined as healthcare services or supplies that are needed to diagnose or treat an illness, injury, condition, disease, or its symptoms and that meet accepted standards of medicine. Medicare, and many commercial payers require a pre-certification process that ensures the exam will be covered by insurance and meets medical necessity. The diagnosis is critical to the payment and is the reason to justify or deny reimbursement. The middle process of the revenue cycle includes the process of clinical coding. CPT-4, or Current Procedural Terminology, 4th edition, codes are used to code procedures for outpatient encounters and ancillary services such as radiology and laboratory. The back-end process of the revenue cycle includes claims processing and payment. A patient's bill will include the charges and CPT-4 code or codes that were entered by the radiology technician, the ICD-10-CM code or codes entered by the health information coder, which will then be submitted to the insurance company for payment. Medical necessity should already have been established on the front end of the cycle where verification of the ordered exam and corresponding diagnosis were already reviewed. The bill will move through the process until payment is received and posted. There are 8 parts to the HIPAA privacy rule. 1. Uses and disclosures of protected health information, FI, identifies how and for what purposes FI can be used and disclosed and identifies requirements for authorizations to release information. 2. Business associate agreements are required when a business associate performs business for a covered entity. For example, an independent billing company provides billing services for a radiology group. 3. Notice of privacy practices, NPP, inform patient of how their health information may be used or shared and how patients can exercise their privacy rights. 4. Right to request privacy protection establishes a patient's right to restrict the use and disclosure of their FI. 5. Right of access to health records establishes a patient's right to inspect and obtain a copy of their FI. 6. Amendment of FI establishes a patient's right to request an amendment to FI. 7. Accounting of disclosures establishes a patient's right to receive an accounting of disclosures of FI made by a facility. 8. Administrative requirements include the requirement to have a privacy officer, workforce training programs, implementation of privacy safeguards, the process for individuals to make complaints, and establishment of anti-retaliatory standards for filing a complaint. The purpose of the HIPAA security rule is to establish standards that operationalize the privacy rule. There are 4 parts to the security rule. 1. Administrative safeguards are the policies and procedures to prevent, detect, contain, and correct security violations. 2. Physical safeguards include identification badges of personnel, authorized access to buildings or rooms limited to certain groups of personnel. 3. Technical safeguards include user identification and passwords, automatic log-offs, to protect the access and control of personal health information, FI. 4. Organizational safeguards such as business associate agreements, or BAA. The United States Department of Health and Human Services Office for Civil Rights, OCR, 2021, reports the greatest incidence of breaches of FI to come from hacking. Other reported incidences are due to theft, improper disposal, unauthorized access disclosure, or loss. The use of this information is enhanced when it can be shared when and where it is needed. Interoperability allows for the sharing of information between disparate information systems. Health information exchange allows healthcare professionals and patients to appropriately access and securely share a patient's medical information electronically. This sharing has decreased the number of duplicate tests performed, improved management of the patient, avoids readmissions, and helps to avoid medication errors. Health information systems, HIS, are designed to manage healthcare data. The HIS allows for sharing of protected health information, or FI, across the healthcare enterprise. The HIS typically includes data acquisition, repositories, and is responsible for management and transmission of the patient's electronic medical record, EMR. The HIS provides relevant information to the Radiology Information System, RIS, for radiology services. The RIS is responsible for management of imaging orders, scheduling and billing, and serves as a method of patient management and tracking, as well as reporting. The RIS typically communicates with the Picture Archiving and Communication System, or PACS. PACS refers to a networked group of computers, servers, and archives to manage digital images. The connection between the RIS and PACS allows for increased efficiency and ease of access to images. Machine learning is an extension of AI that can be defined as a method of data science that provides computers with the ability to learn without being programmed with explicit rules. Machine learning requires a training phase which is supervised by a human, a testing phase which is unsupervised, and a validation phase which seeks to prove accuracy. Many AI applications use a machine learning approach and are being utilized for radiology order scheduling, patient safety screenings, image acquisition, improved accuracy of patient positioning, and suggesting modified sequences on findings.